So what we did in this study was look at suicide risk in veterans. That is people who had left the UK Armed Forces between 1996 and 2018. This was a database study, and what that meant was we combined or linked databases on all people who had left the UK Armed Forces from the Ministry of Defence with our own databases of everyone who had died by suicide during that time period. What we found was that overall suicide risk wasn't any higher in the veterans population compared to the general population. In fact, it was slightly lower, but that didn't apply across the age range. So for young veterans, both men and women aged under 25, the rates were about 2 or 3 times higher than the general population. But for veterans, men aged 35 years and older, the rates were actually lower than the general population. We also found some factors that increased suicide risk. So being male, being untrained, having a short length of service, serving in the army as opposed to one of the other armed forces was associated with a higher suicide risk. Some factors were protective though. So being married, being of higher rank when you're in the armed forces, and interestingly being deployed on combat operations was associated with reduced suicide risk. So that meant for personnel that had seen active combat, had served in a a conflict zone, when they left the armed forces, they were actually at lower suicide risks than others who hadn't seen that active deployment. The other thing we found was to do with rates of mental health contact before death. So veterans, only about a quarter of veterans had been in touch with NHS mental health services before they died. So what do our findings mean? Well, clearly there's a message there about younger veterans. We need to do something specifically about them. But suicide in this study occurred across the age range. So there's got to be a focus, on all veterans, regardless of age as well. What does that focus look like? Well, part of it is making sure people are plugged into the appropriate services, perhaps mental health services, after they leave the armed forces. But also part of it is attending to all those kind of factors we're worried about in the general population, so general things that we know help prevent suicide. So thinking about how we best manage self-harm, thinking about how we minimise alcohol and drug misuse, and thinking about how we tackle social factors and social isolation. And tackling those things together will ensure that we can get the rate of suicide as low as it can possibly be.